What if I told you the decades-long search for a pediatric cancer cure, or the secret to finally curing chronic autoimmune diseases, or even the technology to build bridges that can last 100 years without a single crack? What if all of that could be solved not in decades, but literally in a matter of months?
Curing cancer in months? I know, it sounds like a total sci-fi movie plot, right? But it is actually happening. The United States government has just officially launched what they are calling the most radical overhaul of scientific research in over 80 years. We are talking about fundamentally tearing up the old rule book that has governed laboratories since the mid-20th century. They are entirely rewriting how we discover, well, pretty much everything. The scale of what we are looking at here is absolutely massive. We are talking about a staggering $5 billion war chest. But here's the real kicker. They are completely bypassing traditional university systems. Instead, they are taking this $5 billion and using it to arm scientists directly with elite supercomputers and cutting-edge artificial intelligence. The goal: to race toward medical and technological breakthroughs at speeds human beings have literally never seen before. So, welcome to The Explainer. I am so excited you are here with us today because we are going to break down this massive structural policy shift that is currently shaking up the entire world of global science, technology, and healthcare. Let's jump straight into Part 1, a $5 billion science overhaul. Here is what is on the agenda for today. We are going to look at how the White House and 15 major federal agencies are shifting the traditional research playbook. We'll explore why they are bypassing university overheads, sending direct funding to scientists, and rolling out elite supercomputers and AI datasets. We're also going to cover how this tech is cutting drug discovery times in half, and dive into the incredibly intense political debate over funding accountability that this has sparked. Moving right along to Part 2, the old way versus AI. Okay, so before we get into the core of this new initiative, we really need to get our baseline facts down about how scientific research has traditionally worked. For the past 80 years or so, whenever the government wanted to solve a major problem, they operated through a traditional university grant model. Millions of dollars would be awarded to big university labs. But, and this is a crucial detail, the university typically took a massive cut. We're talking up to 50% or more, just for administrative overhead, things like maintaining campus buildings, keeping the lights on, and paying administrative staff. The money that was actually left over went to the teams of researchers who then spent years and years running manual, trial-and-error experiments in physical test tubes. It is notoriously slow and incredibly expensive. To really wrap your head around this shift, I want you to imagine you're trying to find a single, highly specific key that unlocks a treasure chest. But the catch is, you're standing in front of a giant warehouse containing 10 million mixed-up keys. Under the old scientific research model, you basically had to hire a massive team of assistants. Every single day, an assistant picks up one physical key, walks all the way over to the chest, tries to fit it in the lock, realizes it doesn't fit, throws it away, and goes back to pick up the second key. Testing just a few thousand keys manually like this, it took a decade. It cost millions of dollars. And honestly, it left absolutely everyone exhausted long before finding the right match. I mean, imagine the burnout of dedicating your entire career to just testing the wrong keys over and over again. It is a grueling, mind-numbing manual process. Now, AI-driven science completely shatters those old rules. Instead of running physical tests, AI is essentially a hyper-fast math engine that can simulate reality. It doesn't test physical keys one by one. Instead, it instantly scans the digital blueprints of all 10 million keys in a matter of seconds. It runs incredibly complex mathematical simulations of the lock's internal tumbler physics, instantly eliminates the 9,999,000 wrong keys, and then just hands the scientist the top 3 exact key shapes to test in the real world. This entire process takes hours instead of years. It is completely fundamentally rewriting the timeline of human discovery. Let's look at Part 3, Inside the Genesis Mission. This brings us to the core of what actually happened this week. And the sheer scale of the White House's Genesis Mission framework is simply unprecedented. In a huge joint announcement led by top officials, including the White House Chief Technology Advisor, the Health and Human Services Secretary, and the National Institutes of Health Director, the government unveiled a massive multi-agency mobilization. Over 15 federal departments, including Defense, Energy, and Transportation, are combining their private, specialized scientific data sets, and they are hooking all of that data directly into the Department of Energy's world-class supercomputing network. Together, they are creating what they call the American Science and Security Platform.
Now, the primary flagship initiative inside this massive push is the Biogenesis mission, which is being spearheaded by the National Institutes of Health. The strategy here is crystal clear. The government is deploying advanced AI models against humanity's most stubborn medical nightmares. Priority number one is targeting the root causes of chronic disease. Right behind that are flagship challenges aimed at radically accelerating pediatric cancer research. Why focus on these two first? Well, because chronic diseases and pediatric cancers represent some of the most complex, multi-layered genetic puzzles in existence. These are puzzles that have historically overwhelmed human researchers simply due to the sheer volume of data. This new initiative is engineered to significantly shorten the timeline for solving these exact kinds of problems.
And we really need to talk about that drug discovery timeline, because it is currently a massive bottleneck in the medical world. Traditionally, bringing a new life-saving drug from an initial idea in a lab all the way to an approved product on your local pharmacy shelf takes over 12 years. 12 years! And it costs upwards of $2 billion. Even worse, nearly 90% of candidate molecules fail during manual human trials. Why is that failure rate so insanely high? Because a chemical that looks perfectly safe and effective in a glass test tube often behaves completely differently when you put it into a complex human body. During these long, drawn-out manual trials, researchers will suddenly discover unforeseen side effects or toxicities that force them to scrap years of hard work and basically start all over again. That is a staggering amount of time, money, and hope lost to trial and error. But by using AI to analyze complex biological patterns across vast genomic datasets, which, if you think about it, are basically massive digital instruction manuals for human DNA, scientists can now design hyper-targeted molecules right on a computer screen. The AI can actually predict those toxicities before a physical pill is ever even manufactured. This drastically cuts the time it takes to develop safe, effective treatments by more than 50%. Just pause and think about what that means for a patient dealing with a terminal diagnosis or a family waiting for life-saving therapies. Cutting a 12-year wait down to 6 years or even less isn't just an economic victory for the healthcare system, it is an absolute emotional and human game changer. Now, while healthcare is obviously a massive focus here, the Genesis mission goes way beyond just medicine. It allocates hundreds of millions of dollars into heavy engineering, transportation, and the energy sectors as well. For instance, the Department of Energy has already selected its first batch of 278 projects. These include using AI digital twins, which are highly detailed, virtual clones of real-world machines, to safely run particle accelerators. They are also using these virtual models to design longer-lasting, self-healing building materials for our highways and bridges. They are even using algorithms to accelerate commercial fusion energy and nuclear reactor design. This initiative literally touches almost every aspect of our physical world.
Let's move to part 4, the great academic debates. However, right alongside all of these exciting scientific goals, the White House released an authoritative policy document that has sent absolute shockwaves through traditional academic institutions. Because, to fund all of this, the money has to come from somewhere, and the structure of how that money is distributed is changing completely. The report explicitly outlines a structural overhaul of how federal research money is handled. Going forward, the government is bypassing those traditional university bureaucracies we talked about earlier. Instead, they are funneling research grants directly to individual scientists, private startups, and specialized nonprofit teams who leverage AI tools. The administration's rationale is built entirely around direct accountability. The White House report bluntly stated that federal support for science must be politically accountable. They are arguing that taxpayers should not be paying massive administrative overhead fees to university bureaucracies, when those exact same funds could directly buy supercomputing power and fund frontline researchers. Naturally, this is incredibly controversial, because universities rely heavily on those overhead fees to keep the lights on, pay their support staff, and maintain entire campuses.
This pivot has triggered an intense nationwide legal and academic battle. On one side, you have the government's centralized AI-first vision for science. Direct funding, fast action, and absolutely no overhead. On the other side, university administrators and scientific lobbies are arguing that basic, open-ended academic research requires stable university infrastructure. They strongly fear that stripping away these overhead funds could lead to closed laboratories, massive job losses for support staff, and a total collapse of foundational research programs that just don't happen to use AI. Furthermore, they fear that bypassing established academic peer review boards risks politicizing scientific grants. This controversy is building on ongoing legal battles over federal research block grants, setting up a very high-stakes showdown between traditional academia and this new centralized government approach. We are looking at this impartially here, but it is clear that both sides see the very future of scientific integrity at stake.
Let's look at part 5, what this means for you.
So, moving past the high-level policy debates, let's answer the ultimate question for everyone watching this explainer. So what? How does a $5 billion shift toward AI-powered government science actually alter your daily life, your family's health, and the everyday prices you pay? Let's break it down into real-world impacts. First, let's talk about your family's health. If you or a loved one are living with a complex chronic condition, a rare disease, or a difficult cancer diagnosis, the timeline for hope just accelerated significantly. By using AI to process massive biomedical datasets, meaning billions of data points on human health, scientists can spot hidden biological mechanisms that human eyes missed for decades. This means personalized medical treatments and highly specialized cancer therapies will reach clinical trials and hospital pharmacies years faster. Second, look at infrastructure. Imagine taking your car over a bridge that repairs its own microfractures, or driving on roads built with corrosion-resistant steel designed by a supercomputer. These structures won't crumble as fast. Power plants will run with far higher efficiency. Over time, this lowers national maintenance costs, stabilizes our electricity grids, and actually reduces the taxpayer burden required to fix our crumbling public infrastructure. Finally, this news marks a permanent shift in how human knowledge is actually created. We are entering an era where a scientist's most important lab tool isn't a glass microscope or a chemical beaker anymore. It is a high-speed algorithm running on a supercomputer. By democratizing access to government supercomputers for individual researchers and nimble startups, this policy opens up a golden highway for young AI architects, data biologists, and independent inventors. It proves that the next great medical or technological revolution might not come from an entrenched institutional bureaucracy. It could come from a small, agile team working in a garage. To wrap it all up, the U.S. government's $5 billion rollout for the Genesis mission marks a truly historic turning point. We are watching artificial intelligence, elite supercomputers, and direct scientist funding replace the slow, university-based manual research of the past. By deploying algorithms to uncover the root causes of chronic disease, accelerate drug discovery, and engineer longer-lasting materials, this initiative promises to deliver scientific breakthroughs at a speed never before seen in human history. It is a bold, high-stakes reimagining of modern science. And that brings us to our final thought. Now that the government is actively shifting research funds away from universities and putting them directly into the hands of AI-powered individual scientists, we have to ask, where do you stand? Do you think this centralized, high-speed approach is the best way to cure diseases faster? Or are you concerned that bypassing traditional academic systems removes important checks and balances from the scientific process? It's a fascinating debate, and the outcome will likely shape the rest of our century. Let me know your thoughts down below, and as always, keep learning.